But when Montessa Pittman first starts feeling pain, it seems like nothing out of the ordinary.
I started noticing that I was having a lot of pain in my joints, and I just started realizing I was having a hard time lifting my arms over my head.
She used to be real flexible. She wasn't flexible any longer. All the joints were starting to act up.
Montessa mentions it to her doctor, but neither is overly concerned because the joint pains always seem to disappear on their own.
It would always just come and go. As soon as I mentioned how bad I was feeling, I wasn't feeling bad anymore. I kind of put it on the back burner.
And for 6 months, it stays on the back burner until the winter of 2003, when the pain starts to spread.
I was getting ready for Christmas, and I had been knitting a lot, and I noticed that it wasn't the normal discomfort. It had moved down into like every joint of my finger, and my fingernails were turning blue.
She didn't have a lot of dexterity in the hands anymore. She couldn't even use the hands like this to stir stuff.
Sometimes it would be like a radiating pain in my bones, almost like I'd have a toothache in my bones. But, you know, everybody has joint pain. Everybody's getting older. And I thought maybe I was just joining the club.
Then, 2 weeks later, during a trip to Washington, D.C., a strange new symptom strikes.
It was really a bitter cold evening, and we walked through the field to see the monuments lit up. And by the time I got home, my eyes were really bright red.
I just figured either she was tired or maybe some makeup got in there. And as the weekend progressed, it didn't go away.
The redness and pain persist for the next 2 weeks. Montessa tries over-the-counter eye drops, but they don't help. Finally, she schedules an appointment with her primary care physician, Dr. Tiffany Lowe.
The first thing that she came to me with was her eye being very irritated.
Dr. Lowe sends Montessa to a specialist. He believes she may be suffering from an allergic reaction and prescribes medicated eye drops. But just as Montessa's eyes begin to improve, her joint pain takes a sudden turn for the worse.
One morning, I had to ask my son to help me to get dressed, just so that I could take him to school. That's when it really hit home that it wasn't going away, it was just getting worse.
For the past few months, Montessa Pittman has been quietly suffering from bouts of crippling joint pain. She's tried to take it in stride, but it seems to be getting worse every day. Finally, she decides to go back to her primary care doctor.
She described it to me as whenever one stopped, the other one would start. And I wanted her to go see a rheumatologist.
You know, he moved the joints a little bit in the hand, did the feet and the legs and the knees. And he says, well, you probably have rheumatoid arthritis.
Rheumatoid arthritis causes chronic inflammation of the joints. Left untreated, it can eventually destroy the bones and joint tissue. But diagnosis can be difficult. About 25% of rheumatoid patients never test positive for the rheumatoid factor in their blood.
He was like, well, you can have rheumatoid arthritis for, a long time before you actually test positive for it.
There is no cure for rheumatoid arthritis, but it can be treated. And the rheumatologist wants to start Montessa on strong anti-inflammatory drugs immediately, drugs that can have some serious side effects.
I didn't feel comfortable with that at all. At that point, I had already decided that I wouldn't be going back.
But Montessa is still in pain, and she knows she needs help badly. Hoping for a drug-free solution, she searches for a new rheumatologist, and 1 month later schedules an appointment with Dr. Carolyn O'Connor.
On physical examination, her joints were not swollen and inflamed. There was no fluid in the joints. And her blood work was negative for the various antibodies that we see in rheumatoid arthritis.
However, there is one unusual finding in her blood work.
A blood test that was abnormal in Montessa was a test referred to as anti-nuclear antibody. It was positive at a significant level, not borderline positive, strongly positive.
Anti-nuclear antibodies, or ANAs, are abnormal antibodies that attack healthy cells. Elevated levels of these antibodies, like the levels found in Montessa, are found in people suffering from a wide range of disorders.
An ANA can be positive in people that have autoimmune thyroid disease, Sjogren's syndrome, rheumatoid arthritis, lupus, or sometimes even malignancies.
While it's a significant finding, a positive ANA level alone doesn't tell Dr. O'Connor what is making Montessa so sick. She must run more tests to see if she can narrow it down, but nothing turns up.
We still weren't sure exactly what was wrong.
And she said, to be honest with you, at this point, I really don't know what you have. And what I'd like to do is keep you under observation. I knew it wasn't the end of it. I just had a gut feeling that, it really was just the tip of the iceberg.
Montessa tries to keep up with her normal routine, but her stiff and painful joints are often preventing her from doing the simplest things.
If she's sitting for quite some time, I would have to help her get out of the chair.
She would fall down. If she was on the ground, I would take her to the couch or the bed, and she would start to cry and stuff.
I'm unable to take care of my son. I'm unable to take care of my husband. I have to be cared for. And this is something that was very foreign to me. I'm the person who's always taking care of everybody. I was an invalid, just that fast.
At her wit's end, Montessa returns to Dr. O'Connor.
When she came back, many of her joints were swollen at that point, and she was incapacitated, really.
She just kind of looked at me like, are you ready to start trying some different stuff now?
Dr. O'Connor puts Montessa on a very low dose of prednisone, a steroid used to treat almost any kind of inflammation. However, after just a few days on the prednisone, Montessa comes down with what seems to be a severe case of the flu.
Montessa was unable to eat, coughing, throwing up.
By the end of the week, Montessa's in terrible shape.
She lost maybe a good 20 pounds. Her clothes, they were sort of hanging on her, so we were getting a little scared at that point.
Her husband eventually persuades her to go back to her primary care doctor to see if she can figure out what's going on.
When I saw Montessa the second time, her fever had actually gone up to 101, and she looked very winded, short of breath, and very tired. My biggest concern was that Montessa was just going to decompensate to the point that she could die.
Terrified, Montessa's family rushes her to the hospital.
She was just emaciated, a skeleton with just the skin hanging there. And it was so heart-wrenching, so painful.
The doctors ordered dozens of tests, and the CAT scan of Montessa's chest and abdomen reveals something unexpected, something that has nothing to do with the flu.
I had fluid around my lungs, fluid around my heart. I had a lesion on my spleen and also a lesion on my liver. At that point, I became very frightened.
Doctors tell Montessa that these are all signs of lymphatic cancer. Montessa is horrified.
So as soon as they said lymphoma, I'm scared to death because my mother-in-law, passed from lymphoma.
It makes you feel helpless. Let it be me, not my child.
Montessa Pittman is in the hospital fighting for her life. Her doctors suspect she has cancer of the lymph nodes and have ordered a biopsy. Her family waits for 3 agonizing days until finally the results are back.
Doctor came in and she says, well, it's not cancer, but your lymph nodes were bell-shaped. And that's usually linked with patients that have HIV.
My immediate reaction was like, oh, this can't be.
I'm thinking to myself, at this point, how crazy is it that you're like, you know what? Hey, back it up. I'll take the cancer. I'll just go with the cancer. Let's forget all about this AIDS thing. Then once you come out of that craziness, now I'm like, well, hold up, HIV. Now I'm looking over at my husband like, what's all of this about?
She looked at me like, oh, it ain't me. So I'm like, well, it's not me either.
Things were very tense.
The doctors order yet another blood test, and after what seems like the longest week in the Pittmans' lives, they have the results. Montessa has tested negative for HIV.
I was like, oh, okay. Okay, that's good to know. I think I immediately just started welling up.
But the doctors tell Montessa's family that at this point there's nothing more they can do. They send her home with aspirin to reduce her fever and instructions to follow up with her doctors.
I went into a very deep depression. I'm into like the 2nd month of a fever. I was scared that I was gonna die.
I started to think, can I raise our son by myself?
A few days after she gets out of the hospital, Montessa has a regularly scheduled appointment with Dr. O'Connor, but she's too sick to go.
I got a note from one of our receptionists that Montessa had been in another hospital not affiliated with where I work.
After hearing Montessa's story, Dr. O'Connor swings into action. She contacts the hospital to obtain Montessa's latest test results, and what she sees stuns her.
She had fluid around her heart, she had fluid in her lungs, she had low white count, she had pain in her legs, and she had a little bit of protein in her urine. She had almost all the clinical features of active lupus.
Lupus is a chronic autoimmune disorder that affects approximately 1.5 million Americans, striking women more often than men. During a flare-up, the immune system becomes hyperactive for unknown reasons. It starts to make antibodies that damage many parts of the human cell. These antibodies circulate throughout the body and attack normal tissue. Left untreated, lupus can lead to a fatal infection or kidney failure. African American women are at the highest risk.
So basically, my immune system started attacking every vital organ in my body.
All of Montessa's symptoms stemmed from lupus: her stiff and painful joints, her inflamed eyes, even the unusual lymph nodes doctors found while she was in the hospital. Dr. O'Connor tells Montessa that she will have lupus for the rest of her life, but she can manage the disease and reduce her chances of having another severe flare-up.
It was very serious, but I had an answer. And I was so confident in Dr. O'Connor that I just knew that it was going to be okay.
As it happens, the treatment for lupus is prednisone, the same drug that Montessa had briefly taken in low doses before she checked into the hospital.
We started high-dose prednisone and a medication called mycophenolate. Both of these medications are effective in treating serious lupus.
Doctors believe that these drugs prevent the immune system from making abnormal antibodies.
I started feeling like myself immediately. So like I'm elated. I'm like, whoa, prednisone.
It was like night and day. I mean, she had energy, and she was back to herself.
Had Montessa not been diagnosed and treated when she was, the disease would have continued to wreak terrible and possibly irreversible havoc on her body.
When lupus first presents, it may only involve one organ system, such as the joints. So in those cases, it's very difficult to diagnose. She could have developed more inflammation of her kidney. That would lead to worsening kidney function and even the possibility of kidney failure requiring dialysis.
8 months after her diagnosis, Montessa has not experienced any lupus flare-ups.
I think Montessa will do fabulously well as long as she stays on her medications and she's monitored for signs and symptoms of lupus.
Montessa will have to see a rheumatologist regularly for the rest of her life, but she's feeling great and thankful for the lessons she's learned.
Trust in the people that you've chosen to help take care of you, and tell them everything, no matter how embarrassing or, how minute or insignificant you might think it is. Make mention of it.